All right. Well, good morning, all. I'm Dr. Michael Twyman. I'm a board certified cardiologist. I'm a heart attack and stroke prevention expert, also a biohacking cardiologist. And biohacking just means essentially I do a lot of health optimization, things to help you kind of improve your health that don't require necessarily pills or procedures. And I have a special interest in helping the fire service reduce the risk of heart attacks because I have a family history of heart disease, but I also have family members who are in the fire service. So my brother Jeff's a firefighter over in St. Charles City. He's a captain out there, and my dad was a fire chief at Collinsville and later at JPL, which was a branch of NASA out in Pasadena before he retired. So appreciate what you guys do, and I understand the stressors that you guys undergo. I usually tell people in the person, I did all my training down at St. Louis University, medical school, internal medicine residency. I then had 4 years active duty in the Navy, where I was an internist, mostly taking care of the Marine recruits at Parris Island, but also part of my responsibility was taking care of the retirees in the area. But before I did that, they sent me to a version of boot camp. It's not like the Parris Island boot camp or Full Metal Jacket where they're screaming at you. It was more the kind of the knife and fork club for the nurses, doctors, lawyers, and dentists. But they did give us about 4 hours of firefighting experience. They put us on the USS Buttercup and hit it with rockets, and it was sinking, it was on fire, and we were supposed to try to put it out, and we failed miserably. So I'm glad we got that experience, but I'm glad that I ended up going back to do some more training and become a cardiologist. I do definitely respect the stuff that you guys do for the community. So finished my training in 2009 at St. Louis University, and been out I went back to training in 2009, finished in 2012, and been out in practice since then. And now really focusing more on the heart attack and stroke prevention aspect. I'm still skilled at, taking care of people who are having heart attacks, but it's much more rewarding to help people never get to that stage. And heart disease is the number one thing that takes out firefighters, unfortunately. At least half the line of duty deaths are due to a heart attack, generally within 24 hours of a call. And heart disease typically hits the fire service about 10 years earlier than the general population. Probably multifactorial from the stressors that you're involved in with going to fires and accidents. Part of it's going to be the toxins you get exposed to, but also part of it's going to be the circadian rhythm mismatches that you have. And the circadian rhythms are your 24-hour cycles. So if you're working shift work and you're not getting optimal sleep, your body doesn't have time to repair itself. So today we'll talk, kind of two phases. One is what are some of the testing you do to really figure out what is your risk of a heart attack? And then what are some of the things you can do to reduce your risk that don't necessarily require pills or procedures? So I'm the owner of Apollo Cardiology. I have a practice here in Clayton, which is all outpatient based, and now because of the current COVID-19 pandemic, my practice is now 100% telemedicine based. It was always set up to be that way for patients' convenience, but now everybody's learning how to do telemedicine with our practice. But essentially what I help patients do is, dial down into what is their true risk of vascular disease. And so I know, and I don't know for sure if your guys' department does or not, but I know many of the departments go up to SSM and do stress tests, blood work, and some of them do some advanced imaging to kind of figure out what are the risks. But usually it's this point where I tell people, stress tests are good if you're having symptoms. So if somebody puts you on a treadmill, runs you until you get tired, or they do imaging at the end of it, that's really good if you have symptoms and they're trying to recreate your symptoms. Symptoms being chest pain, chest pressure, shortness of breath, exercise intolerance. But if you don't have those symptoms, the stress test really isn't the greatest predictor of who's at risk or not. Because by the time you fail a stress test, you have to have a 70% blockage in one of your heart arteries. You got 3 arteries that's on the outside of your heart. If the blockages are less than that, you're not likely to have symptoms when you're exercising, but you're still at risk of heart attack. That's essentially what happened to Tim Russert, the NBC news announcer, 10 years ago or so. The man passed his stress test, but he ended up having a heart attack 2 months later. People are like, well, how is that possible? Well, it's one of these, 30, 40, 50% blockages where you have no symptoms. It's like a pimple on the wall of the artery. That pimple breaks. Now you have a 100% blood clot, restricting flow downstream, and then the tissue starts to die. So stress tests are good if you're trying to recreate somebody's symptoms, but otherwise they're not a great predictor of who's really at risk. So there are three main tests that I recommend my patients get to really figure it out. Just listing them off, one is called the CT coronary calcium score, also known as a calcium scan. The second test is called the Carotid Intimal Medial Thickness Scan, or CIMT. The third test is called an EndoPAT, or an endothelial function test. And so one by one. The most important of them is the CT coronary calcium score. It's a $100 x-ray of your heart arteries. Calcium is supposed to be in your bones and teeth. It's not supposed to be in your arteries. And so more calcium in your arteries, more plaque is building up in your arteries. So, typically anybody over the age of 40 should consider this test. And I usually tell people that, insurance is not necessarily going to cover this test because it's a preventive test, but it's the best non-invasive preventive test to tell you, are you at risk of a heart attack? So even if your department doesn't pay for it, even if your insurance doesn't pay for it, $100 gives you the answer. Are you low risk? Keep doing what you're doing. Or you're higher risk? Come see somebody like myself who can kind of find out why you're putting plaque in your arteries. So the test takes about 10 minutes. It's non-invasive, no IVs required, no real special prep is required. They usually ask you not to drink caffeine ahead of time, just to not raise your heart rate. Typically we get the results back in 24 hours. And if your calcium score is 0, your risk of a heart attack is 0.4% over the next 5 years. If your score is greater than 0, depends how high, determines the risk. Anything over 400 is considered a high-risk finding. You probably have at least a 70% chance that one of your 3 arteries, coronary arteries, is going to have a severe stenosis if the calcium score is over 400. Over 1,000, very possibly you have triple vessel disease. Over 1,000, most likely you're going to have a heart catheterization to figure out how bad the disease is and determine if you truly would need revascularization. Just because you have a abnormal calcium score does not mean you're necessarily going to need a stent or bypass surgery. Just put you into a high-risk bucket and lets us know how aggressive to be with all your other risk factors. So that's the best test to know, are you at risk or not, is the calcium score test. Second test I do in my patients is called the CIMT. CIMT measures the thickness of the walls of your artery. The thicker your walls of your artery, the more inflammation of the artery, the more likely you're putting soft plaque down in the artery. So I use the CIMT as a correlate to the calcium scan so that if you're putting plaque here, you're very likely putting plaque in your coronary arteries. So you get the ultrasound, measures the thickness, and tells you basically what your vascular age is. If you're a 45-year-old man and your arteries are this thick and they tell you you're 75 years old, your body's essentially as old as your arteries. So there's things you can do from a lifestyle standpoint, supplement to medication, that can start shrinking that inflammation down and making the artery healthier. So plaque is not necessarily going to keep progressing if you start doing the right things. You can at least freeze it in place and optimally start seeing the plaque progress. So the CIMT you get once, do whatever intervention you're going to do, and then in a year or so, you recheck it and you can see if the improvement is happening. So those are the 2 structural tests to look at, do you have plaque in your arteries? Test, don't guess. The third test that I will recommend for many patients is called an EndoPAT, or endothelial function test. The endothelium is the inner lining of your blood vessels. It's 1 cell thick, and if you laid out all your endothelium, it's about the area of 6 tennis courts. So it's one of your largest organs. One of the major things that the endothelium does is it releases nitric oxide. Nitric oxide is a gas that dilates your blood vessels, prevents stuff from sticking to the blood vessels. So the more nitric oxide you make, the healthier the arteries are. And it's also been demonstrated that people who have better nitric oxide production are going to have less issues, probably 1, contracting, and 2, having bad issues with COVID-19. So nitric oxide is an extremely important substance that your body produces. And you mainly produce it when you're out in the sun, mostly UVA radiation, when you exercise, and then when you're eating green leafy vegetables and beets, those things get turned into nitrates in your saliva. But this EndoPAT test is non-invasive, takes 15 minutes, and it measures essentially a blood pressure in your fingertips, and then you do a stress test to the one arm, you have a blood pressure cuff up higher than their blood pressure, cut the flow off to that hand for 5 minutes, and open up the blood pressure cuff. The blood rushes back down into the hand. And if the blood vessels are healthy, when they see this huge slug of blood coming down, they will start releasing nitric oxide to dilate. The more they dilate, the better they are. So they should at least essentially double in size. And then that means you have healthy endothelium. If your endothelium is abnormal, it's sort of like having a tennis net that has some holes in it. just much easier that the balls are going to get through the holes and start building up plaque in your arteries. So those are kind of the 3 tests that I recommend. The most important is the CT coronary calcium score, about $100. If there's, more risk, or, you really want to have the full package, my truly low risk, then you go add on the CIMT and the EndoPAT test. So now I'll transition a little bit, what can you do about it if you find plaque? So again, plaque is prevalent. 6 out of 10 people who do the calcium score test over 40 are going to have an abnormal score. Then the whole job is to do the detective work. What is the plaque being put in there from? It's not all about cholesterol. Cholesterol is just one of about 400 things that can put plaque in your arteries. Now, everybody probably in that room has had the 5 major things checked. You've had your blood pressure checked, your cholesterol, your blood sugar, and you would know if you're overweight if you smoke. But those 5 things, even though they're the 5 most prevalent things that can drive plaque formation, they're not sufficient to know if it's everything. So you have to do more detective work, and usually that requires advanced blood work. So, in the blood work, you're looking at particle number. Particles are the things that actually wrap up the cholesterol and transport it around the system. Then there's also inflammation. Inflammation is your immune system turned on and staying on. If your immune system's always turned on, you're more risk that your arteries are going to basically be on fire, and they're going to be damaged in that process. And there's some other genetic markers you can check. Lipoprotein A, which is similar to LDL, but more likely to cause plaque. LPA was actually one of the things that Bob Harper had. The guy from The Biggest Loser, looks very fit on the outside, didn't know what his insides looked like, and he ended up having sudden cardiac death in the gym and got successfully resuscitated. Ended up having severe stenosis of his LAD, got stented, and now is recovered. But he had lipoprotein A. 20% of the population has it, and that's not routinely checked on traditional blood work. So you kind of have to keep doing more detective work to figure out why that person's putting plaque in the artery in the first place, and put a plan together how to stabilize it and ideally start reversing it. So that kind of transitions into kind of my 4 pillars of health, or you can think of it like a 4-legged stool. If one of the legs, sure, hang on. I assume you guys are probably getting a call. This happens pretty much every time I give one of these kind of talks. All right, so as I was saying, there's 4 kind of pillars of health, or kind of a 4-legged stool. If one of the legs, isn't shored up, the thing falls over. So that's sort of what your health is like. So the 4 pillars are, sleep, nutrition, exercise, and stress relief. And we'll kind of go through all of those. So start first with nutrition, because that's usually where I get most of my questions. Nutrition is important, but it's not necessarily the be all end all. If there was a perfect diet, everybody would be doing the perfect diet. There's 300 to 400 different books written a year, diet books. And if one of them was going to, be the perfect one, they would have hit upon it by now. So it's very individualized. Depends on what your health goals are, what your health diseases or illnesses are to begin with, and what your kind of plan is. Is it body composition changing? Is it reversing prediabetes? Is it improving lipids? Are you an athlete and have to kind of pack on more muscle? All those things are going to impact what you need to do from a nutrition standpoint. But some of the basics that I tell people is focus on the timing that you eat. That's extremely important. There's a very good book that explains this called The Circadian Code by Dr. Panda. Nutrition, is information to the system. You have a circadian rhythm. It's your 24-hour cycle. The 24-hour cycle gets programmed by light and also the timing that food comes into the system. So when food comes into your system, it activates certain genes, clock genes, in your liver and your gut. So anything you put in your mouth in the morning time that isn't water starts the clock for the day. Ideally, you should be done 12 hours after that period. 12 hours gives your body enough time to shut off that machinery at night and start going into repair mode. And if you're trying to lose weight, reverse diabetes or prediabetes, or even you just don't sleep well, you stop eating about 4 hours before you naturally go to bed, the machinery shuts off and things start to improve. So even if you don't change up what you eat, if you just change up the timing that you eat, you should notice some improvement. The other big thing is eating seasonally. So I frequently get asked about the keto diet. Keto diets can work, but it depends. Depends somewhat on your genetics if you're a good fat transporter. So that's what I will check when I do my advanced blood testing on people to figure out if keto would even work for them. But keto is also seasonal. So 200 years ago, you could only eat what grew in your local environment. You didn't get blueberries from Chile at this time of year. It's not that stuff is going to necessarily kill you this time of year, but you would eat what normally was growing outside your home or whatever you catch, kill, or fish. So the better you can eat seasonally, the better you do. Because again, food is information. It's basically, sunlight grows the food. You either eat the food or you eat the animal that grew the, I'm sorry, you either eat the animal that ate the plants. So your body's basically decoding sunlight. And if you're eating stuff that is grown in high light, so like a banana, and it's snowing in St. Louis, there's a mismatch in the body. You have 4 surfaces: your skin, your airways, your gut, and then also your skin and your eyes, I should say. So 4 surfaces. All those surfaces have to have the same information. So if you have information on your skin that it's freezing outside, but you're inside the same, tropical fruits, the body's like, this isn't possible. I can't grow here this time of year. So you want to try to eat seasonally when you can. The other big thing is eating seafood or fish. The DHA in that is extremely important. That's an essential fatty acid. Your body can't produce it, but your body needs it to shuttle energy to the cells. It's sort of like insulation to wires. I also sometimes tell people it's like a half-charged iPhone. If you don't have enough DHA, your body has energy from the environment, but it's not going to last as long as you want it to. So DHA is extremely important, and you can really only get that through seafood. Eating flax seeds and nuts has extremely low levels of omega-3s, and it doesn't always get transmitted into DHA effectively. And then protein is also extremely important. High quality protein. It can be animal or plant-based, but it's essentially necessary for muscle protein synthesis, which I'll talk a bit more about in the exercise part. So muscle mass is your metabolic currency. The more muscle that you have, the better you tend to do. When you get sick, you basically use your muscle as a bank and make withdrawals from it. So for those that know my brother, he ended up getting viral meningitis last fall, ended up on a ventilator for a few days. By the time he got out of the hospital, he literally could not walk. He's an extremely fit firefighter, was playing, men's league hockey up until the week before this happened. It took him a while to regain his strength. Fortunately, he's back to full recovery, back to work, doing well. But if he didn't have the muscle mass to give back, which he lost 12 pounds of muscle during the hospitalization, he would have had a much longer recovery. And so you stimulate your muscle by resistance training, which we'll talk about, but also protein timing. So bare minimum, you need at least 30 grams of protein 3 times a day to stimulate the muscle. As you age, you start having anabolic resistance. You just don't build muscle as well. When you're 20 years old, you can go away with a lot of stuff because your hormones just work more effectively. But as you age and you want to maintain muscle, you have to put the right substances in there and the protein. You don't have to remember this exactly, but you need probably near 2 grams, 1.5 grams, 2 grams of leucine, which is a branched chain amino acid to actually stimulate the muscle protein synthesis. So those are the nutrition tips. Second leg would be exercise. And I'm probably the cardiologist that can tell you, chronic cardio is not what you really should be shooting for. That the cardio is important. If you're going to do cardio, it's generally better to do interval type training where you do some fast, slow Tabata type training. It's more physiologic to get your heart rate fast, let it recover fast and recover, than have your heart rate, staying 150 the entire time for 20, 30 minutes. And that's, cut down on the time that you work out, and you also get probably a better physiologic response. The thing I really do recommend people focus on is the resistance training or the strength training. Your muscles, need to be stimulated by heavy weights. You don't need to be a power lifter per se, but you need to stress the muscle enough that the muscle says like, I can't do this anymore. And then your body does the repair. If you keep doing light weights and don't really ever stress them, you don't have the adaptive response. Then transition into stress. Obviously, these days are going to be more stressful for many people, but stress is kind of what's baked into a lot of your guys' job duties. So you have a autonomic nervous system where you have a sympathetic nervous system, an autonomic nervous system, or parasympathetic nervous system, I should say. Sympathetic is your fight or flight response. So you're at rest or you're sleeping, tones go off, you go to 100 miles an hour, got to go time. It's how fast can you get back down to balance, and that's how well you can bring back up your parasympathetic tone, your rest and relaxation arm of that nervous system. So many people get stuck in this fight or flight response. So yes, when the tones go off, you need to have your adrenaline go up, your cortisol go up. That raises your blood sugar, raises your blood pressure, fuels your muscles, and go do what you need to do. But if you always get stuck in that fight or flight response, cortisol makes your blood stickier, more likely to cause clots. Adrenaline is going to keep your blood pressure up, more likely to cause strokes and heart attacks long term if your blood pressure is always up. So how do you kind of cool down some of that stressor? So this is where you got to kind of individualize it to each patient. But my general recommendations are find something that works for you. Meditation tends to work for myself. There's many free apps that you can try: Headspace, Calm, 10% Happier. Doing yoga, breathing exercises. There's box breathing, where breathe in for 5 seconds, hold for 5 seconds, breathe out for 5 seconds, hold for 5 seconds. So it takes 20 seconds to do a cycle. Do that 5 times. That deep breathing stimulates your vagus nerve, stimulates that parasympathetic response, and brings those stress levels down. The other thing you do, there's a device called Heart Math, made by a company named Inner Balance. It looks like a pulse ox clips to your ear. It's measuring your heart rate, and it has biofeedback. So as you're doing these breathing exercises on the app, it lets you know if you're actually doing it right. You get feedback, turns green, good. If it stays red, means your body's still under a lot of stress, and it just tries to kind of show you how to do the breathing exercises to put you into that better parasympathetic tone. And it's measuring something in that clip. It's measuring not just your heart rate, but it's measuring your heart rate variability. Your heart rate variability is the difference between the RR interval and EKG. So when you breathe in, your heart rate expands. When you breathe out, it contracts. So normally your heart rate shouldn't be 70, 70, 70, 70. It should go in and out. And the more that it expands and out, the more variable it is. The more variable, the healthier the heart is. The tighter the heart rate variability, the more stress the body is under. It's also a good marker for overtraining for athletes. So you measure your heart rate variability in the morning time, which you can do with different Bluetooth chest straps, and some of the watches can do it as well. But you get a baseline heart rate variability, and then after a few days, you know what it's going to be for your baseline. And then if you overstress yourself, you end up doing a half marathon or something like that, the heart rate variability comes down. That day is not a day that you want to go out there and push it hard, because you're going to overstress the body. You want to wait till your heart rate variability recovers. So you can measure that fairly inexpensively. And then we'll transition into the fourth pillar of sleep, and sleep is probably the most important of the pillars, and the one that's usually overlooked. The saying, "I'll sleep when I'm dead," is unfortunately probably true. Those people that don't sleep well are going to have more chronic diseases and likely succumb to those much earlier than people who can get their sleep dialed in. And I know sleep problems are, an epidemic in the fire service. Part of it's going to be your disrupted sleep patterns from the job that you do. But, many people have a medical issue that doesn't let them sleep. They have sleep apnea. So sleep apnea is when you stop breathing when you sleep. If you snore, if you wake up with headaches, you wake up like, hey, I didn't feel like I slept, I could sleep the rest of the day. You may have apnea, and you should probably get that evaluated. There's different ways to evaluate it. There's home sleep studies now. Looks like a little watch, a little finger probe, little thing sits on your chest. It watches the rise and fall. You sleep with it in your own bed, and it's pretty accurate at telling you if you have sleep apnea. Now, if you have something else where you have central sleep apnea, restless legs, or some other type of more complicated sleep disorder, you're gonna have to go to do an in-lab sleep study. But if you have apnea, get it treated. You lower the stress on the system. You bring blood pressure down, cortisol levels down, less likely to have heart issues going forward if you get your sleep apnea treated. But for people who don't have sleep apnea and still don't sleep well, many times it's due to their disrupted circadian rhythms, that 24-hour cycle. So your circadian rhythms, we already talked about one, is it's programmed by the time of the day that food comes in. But the second thing is by the light that enters your system. So these glasses are a particular brand of blue blocking glasses. So it filters out a lot of the light coming from this monitor that I'm looking at right now. The sun has blue light, but it's always balanced by red light. So for optimal is that you'd want to see the sunrise every single day. I haven't missed one since the beginning of 2019. You don't need to get a ton of it, but 5-10 minutes a day would be optimal. More, even better. But go outside, let the light hit your eyes. So if you have glasses or anything else, just tilt it down so that the sun can enter your eyes. That light is information, and it programs a part of your brain that turns on a way that you make your hormones effectively throughout the day. If you always skip the sunrises and don't wake up, your hormones will get made off kilter, off cycle. Then, when you're inside in front of technology like this or artificial lights, which I don't have on in this room, you protect your eyes. The technology that you're looking at has about 4 to 5 times the intensity of blue light that sun does. And there's no significant amount of red light coming from your computer screens. That blue light is stimulating. Blue light raises cortisol, tells your body wake up. And so that's what the sun's supposed to do. It tells you wake up. And so if you keep looking at your computer into the evening time, you're still giving the signal to your brain that it's noontime, especially if it's noontime in July, the highest level of sunlight there is. High levels of blue light destroy melatonin. Melatonin is the hormone that starts the process of sleep, and melatonin is the hormone that does repair of the mitochondria at night. The mitochondria are the things that make energy in your cells. And your brain, heart have the most mitochondria. They're things that, if they're broken, the energy levels go down, you have a brownout in that area, that's where you start getting problems. That's why heart disease and strokes and Alzheimer's, all those things are the top level things what are causing people to pass away. So if you fix your mitochondria at nighttime, you're less likely to get those problems. And it's mainly driven by the melatonin. The body's making melatonin throughout the daytime. It doesn't get released until it's dark. And taking oral melatonin is not something that can make up for that. And you actually can do harm to your eyes if you take oral melatonin long term. So melatonin and cortisol are linked. So if your melatonin levels are low because you're in front of blue light all day long, you'll have high cortisol levels. High cortisol levels will raise your blood sugar, make you potentially pre-diabetic, even if you're not eating a bunch of carbs and crap. But that high cortisol puts you at increased risk of heart attacks and strokes. And high cortisol isn't going to let you sleep effectively. So you block the blue light by wearing glasses. And then also, there's different apps for computers. One is called F-Lux. The other one is called Iris, I-R-I-S, that dials down the amount of blue light on your computer screens. Your phones also have it, the night shift mode on iPhone, and Droids have their version of the blue light mitigation. But those still are not enough. You still have to kind of wear the glasses if you want to go 100% optimal. And then after you've kind of controlled your light environment, you want your sleep sanctuary, your sleep cave, to be set up that way. So your bedroom should be as dark as possible. So dark you don't see your hand in front of your face. So if you have to sleep during the daytime, get blackout shades, wear an eye mask, do whatever you need to do to make it as pitch black as possible. If you need a night light because you got to get up in the night or whatever, you want to get an amber bulb or a red bulb that doesn't destroy your night vision. Lowbluelights.com sells those things, or find them on Amazon. Cool in your bedroom, you want it to be probably 6 to 8 degrees or cooler. Cold helps stimulate deep sleep. And then you also really want to condition yourself that bed is the place that you go to recover and sleep. It's not a place to sit down and read your phone, watch TV, read a book. You don't want to do anything in bed that wouldn't get you ready to go to bed. So and it's much more important the quality of sleep than it is exactly the number of hours. Very healthy people probably only need 6.5 hours of sleep. People who are ill probably need 8.5, 9 hours of sleep. So sleep for as much sleep that your body needs to feel like it's recovered. But it should be that you don't feel like the next day that you got to pound coffee to stay awake, or that you must take a nap to function. If you take a nap here and there, it's not a problem. But if it's affecting your night sleep, then you want to kind of dial back on the naps so that you try to get back into a more routine cycle. So those are kind of the 4 tips on the things you can do to reduce your risk. And then also if you have disease, what you can do to stabilize it that don't require pills or procedures. So that's kind of the basics of my discussion. And then I usually at this point open up to any questions. So if you guys want to type the questions in or ask them live, I'm more than happy to answer anything for you. And so I just unmuted you guys.
All right, Zach.
Maybe I'll just mute one of you. Which one should I mute? The Rockhill Fire or the Kevin Halloran one?
Can you hear us?
Yes, I can.
Okay. So you also have this on YouTube, right?
It will go up on YouTube, yes.
Okay, because we lost one of our crews is gone. They've been gone for a while.
Okay,
So I want them to be able to review it.
sure.
And then I'd like to sit down with you and, figure out a plan where we can have the blood test done. I'm definitely for anything that can help, these guys. If we can catch something early, I'm all in on that.
No, excellent. And yeah, my kind of strategy would always be, for anybody over 40, get the CT coronary calcium scan. If their calcium scan is 0, those people are low risk, and generally they can work with a primary care docs and keep doing what they're doing. But if you catch somebody with a score greater than 0, then that's when you kind of do the deep detective work and try to figure out what's putting the plaque in your arteries and then what you can do to stabilize it.
Okay. Yeah, everybody in the department's over 40.
Okay.
So we're there.
Okay. And there's like 3 different locations in St. Louis that do it for the $100, so it doesn't really matter what location they go to.
Okay. Well, that's one of those things, if you and I can follow up,
Sure.
where I can get that stuff and then we'll get a plan going.
Okay.
You guys have any questions?
The place we do our physicals can't do that same test.
No. SSM doesn't do the scans, do they?
They probably would, but they wouldn't do it as part of the usual physical. You'd have to ask for it. And I don't know exactly what SSM charges for it, but it's probably between $100 and $200 when they do it.
Okay. Yeah, because we do all of our departmental physicals through SSM.
Mm-hmm.
I believe your brother does them there as well.
Yeah, he goes up to the DePaul one.
Because I think, that's the DePaul ones, that's SSM.
Yep.
We do those. We do ours down at St. Clair.
Okay. Yeah, usually the South County ones go to St. Clair and the North County ones go to DePaul. So they do the same program.
So I don't know if they do the scans there, if we just have to find a third-party vendor.
Yeah, kind of where you guys are at, probably Excel Imaging on Watson Road. They're probably the closest one for that.
Okay. All right. Well, you guys have anything else?
No, and I'll probably watch this. I think we missed a little bit earlier. Trying to figure out the sound, so maybe we get to work on Thursday. We'll fire it up.
So what the guys are going to do is we'll rewatch this as well, so we can see your whole presentation again.
Sure.
And then it sounds like we're going to set up stuff. Hang on one sec.
All right, we'll cover you.
So, like I said, you and I will follow up, and then we'll get a plan set up.
Okay. Yeah, that sounds excellent. And then, if people want to hear like other questions asked, on my YouTube channel, I've, been out to West County and Metro West and stuff. And, people want to hear the kind of the Q&A stuff. That's all at the end of those videos. But, I do thank you guys for, Skyping me in today, or Zooming me in, I should say. I'm definitely interested in working with you guys. And once this COVID stuff kind of cools down, and we'll get everything set up for you.
Did you watch the Netflix movie, The Game Changers?
I did, yes.
What do you think of it? What did you think of it, Matt?
Yeah, it's infotainment. I don't think it's scientific, and it has an agenda. It's obviously the plant-based agenda, and there wasn't very evenly just like the data wasn't evenly presented. So I'm not anti-plant-based by any means, but the issue is that that people if they've really followed everything in the Game Changers, they're not going to necessarily have optimal health. So veganism is a choice. It's not necessarily the thing that people should be focusing on for optimal health. If you're a 20-year-old athlete, you can do a lot more things. If you're a 55-year-old guy trying to go for longevity, that same diet plan is not necessarily going to work for you, because you're probably not going to get enough protein in the diet. That's the biggest issue with it. Plant protein can work, but you generally need to take about 30 to 40% more protein from a plant source to get the same amino acids. So that's usually the issue with it. So it's maybe an interesting conversation starter, but from a standpoint that it's scientific and this is how everybody should be, definitely not.
Okay.
Thanks.
Sure.
Okay. And your YouTube channel, we just go under your name?
Yes, for now, you know, because I did a call last night for some people going over COVID-19 updates. So right now I have like 63, 64 subscribers on YouTube. So yes, if you could subscribe to my YouTube channel. Right now it's going to be like channel and has a bunch of initials after it. But if you just search for Michael Twyman MD, you can see it, and I'll post this up here in a few minutes. But once I hit 100 subscribers, then it'll be just, you know, YouTube, Dr. Twyman. So I will, like I said, once this meeting's done, it takes a few minutes for it to transfer, and then I'll put it up on YouTube this morning.
Okay. Well, I think that's pretty much it, Doc. We really appreciate your time.
Oh, you're very welcome, guys. You know, take care, and if you need anything, just get in touch with me, but I'll be back in touch with you guys once everything cools down.
Great. Thank you. I appreciate it.
Thanks, Doc. Thank you.
Have a good day, guys.